Good morning. My name is Michał Dulewski. I am a physiotherapist in one of the Polish clinic and also a lecturer in physiotherapy in one of the Polish university. Today I'm going to tell you about this device. This is 3D platinum table for the mechanical traction. 3D means three-dimensional, like this table do, and mechanical traction may be for lumbar and for cervical spine. What are the elements of the platinum 3D table? Starting from the head, this is the therapeutic panel in which you may choose the parameters like force, time of traction duration, type of traction, or set the position of the leg part or the height of the table. Headrest. Another element is headrest, which has regulation only in one plane, up and down, and through this cervical attachment, you may perform the cervical traction, which is built in this part. Neutral or stable part, middle part, which is unmovable. This is only one part which is not moving through the whole traction. Most stable, on which patient sits or starts to positioning himself. Lumbar part or leg part. This is movable in three-dimension part, which can be moved in the sagittal plane for more flexion or extension of the patient lumbar spine. It may be rotated for the patient or side bending to achieve the best position for the patient and most beneficial traction. For that part and for lumbar traction, we also have two belts. This is belt for thoracic parts, which allows to stabilize the patient on the table. And this is lumbar belt, which is attached this place and pulls the patient pelvic with legs away from the thoracic cage, which is what is very important. Whole this part of table will go away from the stable part. So pelvic lying on this leg part or lumbar part will slide away with the lumbar belt from the thoracic cage, which is placed on this level. Doesn't matter what position of the table we set, the traction will be during the axis, which ensure us that this is pure traction for the spine. How to operate this table? First of all, headrest. Press the lever, move it down or up. This is used when you want to set the correct position for the cervical spine for traction, which should be in this lordosis and at this level at which you have problem and won't have the most beneficial traction. Up and down. The cervical attachment. You should put it in the middle of the headrest, place it downward to the leg position and rotate. When patient head lays on the attachment, it is stable and will not fall out from this. Velcro strips to set the patient head in a position on the attachment. And regulation of width of the neck. Head should be like here, and depends on the patient neck, how wide is it, we may regulate this to have firm grip over the head. The regulation of whole table up and down is from the therapeutic panel, and we will discuss it a little later. Thoracic belt which is for the thoracic cage, should be placed in the attachments between the headrest and the neutral part. Here are the Velcro strips to attach this part here. One tip: it is easier to put it through the attachment when you move the headrest down and make the Velcro strips to have the grips. Of course, before you put the patient on a table, move the headrest to the comfortable position. This thoracic belt is used only for the lumbar spine traction. For the cervical, you don't need this. Lumbar belt attached to this place, like we said before. What is important is to make sure that those belts are not, I show it here, are not turned, squeezed, or in any other place in knot. We must straighten them away. And put it there. It's also important to put it completely to the attachment and make sure it's not only like here, because it may goes away. So make sure it goes completely there. Okay. Okay. If one of the attachment is opposite, we may leave it like this, or put it in opposite direction to have symmetrical adjustment. Lumbar part of the table. Three-dimensional, so it allows for the flexion and extension of the spine, side flexion and rotation. Here you have a possibility to rotate. Another one allows you to side bending, side flexion. And flexion and extension, or movement in sagittal plane, are performed from the therapeutical panel. Construction of both thoracic and lumbar belt is connected and closed with 3 strips. Why is that? First of all, it allows to adjust the force of, for the patients, different force of different part of the thoracic cage or pelvic. It's quite important in situation when upper thoracic strip goes on the breast, especially at women, or at lumbar belt when lowest strip goes over greater trochanter and may cause irritation. In this case, we must connect all of the strips, but 2 of them, upper ones in lumbar belt, we place very tight, we tense very tight. The third one, not necessarily. The same situation is in thoracic belt. We must tense much the lower 2 strips, but the third one may be left loose. It's better to close them, free of all three of them, but not necessarily to make it very tight. To start working on the table, you must plug it in and press the power button. Closing the belts. First of all, before setting the patient in the belts, you must remember to leave a little more free strips, a little longer than it should be, because it's easier to adjust it later. If we ask the patients, we should ask him to sit on a neutral, stable part, on the middle part, lay down on his back, and move a little lower. Pelvis should be below the space, below the gap. Okay. We do not need to uncover patients completely, but we must have skin below the ribs and the pelvic. So when we have uncovered the patients, we put the thoracic part in this way that the lower strip of the thoracic belt should be below the ribs. So it should go like this to pull up. It's not needed to zip the patient very tight, to close the patient very tight at this moment. We will do it at the very end. What is very important is to make sure that patient hands are below the shoulders. It must not be over the head or like this, because the ribs are in a wrong position and easier to have injury. So we close the thoracic belt. If the patient is smaller and the thoracic belt, especially at women, goes on the breasts, it's not needed to close tight the third most upright belt. Okay? The other belt, lumbar one, should be higher than the pelvic rim. Okay. So the highest strip from the lumbar belt should be above the pelvic, higher than pelvic rim. So we close it. At this moment, very easy. As you see, the lumbar belt is on the thoracic one. It's not a problem if the strips are not crossed. This way is the problem. If they are not crossed, it's okay. Also, the lowest strip of the lumbar belt may not be tight if there is a problem with the hips. 2 of them will be enough. Patient positioning. When you have patient set in a belt, we should adjust the position of the patient to have the most controlled and most effective traction. We may do this using just the position of the legs, but it's sometimes hard for patients to keep this position for 15 minutes or longer. We may use a table for the patients. But you must remember to have all strips above the chair. Okay. And we may adjust the height of patient leg using the adjustable part of the chair. The best position for the patient is when his lumbar spine in this moment is in neutral position. We also may use the mechanical properties of the table and lift the mobile part a little higher. Okay? Is it comfortable?
Yes.
What is most important? Patient must be in comfortable position without any pain. If there is a problem with severe pain or scoliosis, we may adjust the patient position also in other planes for side bending and rotation if it's needed. If not, the best position without severe pain is without side bending and rotation, and in spine in neutral lordosis or between lordosis and kyphosis. When you have the patient in good position, we should go for the another steps. So take all loose from the strips, close tight belts, and start traction.